ng input, yun po ang lumalabas sa output.
So, dapat ba ganon?
Dapat po, Dok, sa input, hindi po magsasalita yung mga hindi po dapat magsalita.
Kailan? Lagay ka lang na lagay. Tapos check nyo na yung mga details. Marami pa rin ako nakikita sa ilalim. May Q&A, may chat, may share screen. Marami. Tapos nakikita ko sa taas, Sandra Navarra, Danilyn Torres. Bakit hindi ko pwedeng makita?
Sa ano, Dok? Sa output po.
Output, oo.
O, Dok, kasi nakapa-participant ako, ang nakikita ko lang, Dok, chat, yung raise hand Q&A, tsaka disconnect audio lang po. Baka naka-panelist kayo, Dok.
Okay. Sige. So siguro nga panelist. At least nakikita mo yan as parehas.
Ayan, Dok, bumalik na yung echo nyo. Ay, nilagay na rin ako ni Kuya sa ano.
Okay. So nakikita sa participants. So kunwari i-ano mo ako, pakilagay ako sa lagay mo ako sa participant. Saan ba yun? Attendees. Lagay mo ako sa attendees. All right. Yeah. Yeah, I can see that. So ang nakikita ko lang is the chat, raise hand, and Q&A. Alisin mo na yung raise hand. So ang lalabas lang dito will be chat and Q&A na dapat imo-monitor ko rin ito. Ang gagawin ko na lang i-silent. So during the interactive, which I will moderate, dapat tanggalin ko yung speaker. So it's quiet now. And then I will just monitor the chat and the Q&A. Again. Bakit kaya nag-feedback? Tinanggal ko na yung aking sound.
Try mo kaya, Kuyang disable yung audio ni Doktora sa output.
Oo.
Hindi, Kuya, di ba webinar ka?
Hindi, kasi tinanggal ko sa computer ko yung so wala akong naririnig. Actually, kung output lang ang pakikinggan ko. Paano? Pwede mo bang so na-disable mo na? Bakit meron pa rin feedback? Pero kung ako na ang nagsasalita, sige, i-ano ko na ha. Kunwari, Ivan, are you still there?
Yes, Doc.
Sige, tayong dalawa ang lalabas ngayon. We will practice the interactive session. Can you share your video? Start your video. Bakit ayaw mag-start? So, kunwari tayo ng dalawa and the rest of the panelists, the speaker. Okay, so magsalita na tayo, Ivan.
So, hi Doc. Good afternoon po.
Salita ka lang ng salita, Ivan.
Doc, ano ba mas okay, Doc? Live ko i-lecture o mag-ano tayo, mag-record? Kaya Marlon.
Yung lecture mo, kailangan talaga recording. Para
Okay.
tuloy-tuloy yung pag-project niya na recording. Tapos from the interactive, the practice points, wala na ano. Ako na mag-share ng slides. So I will share the slide from here. And then, everybody is on. Sige, Danilyn, can you open your video para mas spotlight sa iyo? Kung kunwari ikaw si sino ba? Kunwari ikaw si Bergantin. Sige, pag nakalagay dyan sa panelist si Bergantin, okay, so yun ang gagawin. So ito ngayon sa stage. So, are you all seeing the output?
Yes, tatlong camera.
Looks good, no?
Yung black screen sa tabi, yun nga lang wala.
Kung nag-spotlight, Doc, kailangan manual spotlight yung magsasalita.
Okay.
Sino mag-i-spotlight? Si host?
Si host o Doc. Opo.
Okay. Sige. Sino, Marlon, sino ang pinaka-techy sa mga fellows? Para bibigyan mo sila ngayon na assignment kung sino assigned dito. Staff mo. Oh, the fellows na lang. Fellows. Volunteer. Who will assist Marlon on doing
Pwede
this?
po ako, sir. Pwede po ako.
Okay. Sige, si Peter. And para ma-practice nyo yung ano mismo, yung the way it goes. Yeah, this one now looks good. Tatanggalin ni Marlon yung raise hand kasi wala dapat magsasalita. So now I'm looking at the output. And yes, it looks okay. Kasi kung pupunuin mo ngayon yan ng ilan pa tayo. So you will have, except for Cervera, so you have 3, 4, 5, 6. Bali 6. Sige. Okay, let's choose 3 more people. Vince, Eric, and can you turn on your, kunwari, Vince, ikaw si Lichao ko. Eric, ikaw si, sino pa ba? Ever. Eric, kunwari, ikaw isa sa panelist ka. So this is what's going to happen during the interactive. Turn on your video. Ayaw mag-on? O sige, sino lang gusto mag-on ng video? Wendell.
Minamanual ko pong spina-spotlight po. Yung mag-on ng video.
So ikaw ang nag-i-spotlight.
Opo.
Kasi host ka. Tama?
Co-host po, opo.
Ako host. Okay, so the co-host can spotlight on that. Okay, good.
Pero pag hindi po, Doc, mag-open ng cam, hindi siya masa-spotlight. Kaya apat lang po tayo naka-spotlight po.
Oh,
Ay, spotlight.
hindi siya. Yeah, which is okay. So,
Ganyan.
in-spotlight mo kay Robel.
Yes po.
Okay. Sige. So, yeah, hindi naman talaga mag-open, I think, ang spotlight kung naka-close yung video. So, may instructions yun na yung mag-open lang ng video will be the ones who are already going to talk on that particular, during that part of the session. So, okay na. Tapos, pagkatapos itong session na to, so, okay, thank you very much. Let me just hand it on now. Dr. Julie. So, tatanggalin mo ba yung spotlight? Okay, si
Yes
Julie.
po. Remove spotlight.
Okay, so, okay, so somebody controls the spotlight. So, okay na yon. Marlon, ang magko-control na ng spotlight will be si one of the fellows. O si Danilyn, ikaw na?
Hindi po daw.
Okay. Yeah. Yeah. Sige. Para dun ka na lang magfo-focus on what's coming out in the output. Okay, ang ano na lang natin is kasi ang ano naman yung mga participants kailangan when the show is going on already, so when the session is ongoing, dapat tayong mga nasa panelist should have already naka-mute na ba? Tama ba? Magpakita ka nga ng, can you show the recording of, sige, habang nagre-recording, Marlon?
Alam ko na, Doc, kung bakit nagkakaroon ng echo. Nung disable ko yung audio, Doc, ng output ko, nawala yung echo. So,
Okay, can you do that?
So, hopefully, Doc, kasi di ba during the webinar itself, wala, Doc, audio talaga. Disabled talaga yung audio, Doc, ng lahat ng participants. They don't have cam and mic. So, I am assuming na magiging ganun po yung mangyayari. Mawawala po yung echo.
O diba, why don't you do that now?
Ay, Doc, tinanggal ko nga po. Hindi, na-recover pa din. Wait lang. Nakamute ko nakamute na ako. Ha? Alisin ko yung volume ng output. Hindi ko maririnig yung ano. Hindi ko kunwari as participant nga. Input tsaka output.
Rebel, ano ka ba sa ano? Ano ka sa webinar? Participant?
Phone, Doc. Kanina, Doc, participant, pero ngayon, Doc, meron ng mic eh. Baka nilagyan ako ni Kuya ng mic.
Tanggalin mo yung mic. Tanggalin mo yung mic sa output, sa participants pala. So lahat na participants walang mic. Pati ako. Tanggalin mo, lagay mo lahat na tao sa participants. As attendees pala, sorry, attendees. Place everyone as attendees, including me. Hindi pa pwedeng, yeah, meron pa rin eh. Hindi ba,
Sa
okay,
output.
yeah, wait. Dali, ha? Okay, yung volume ko kasi dito, naririnig ko pa rin. Kasi ako ang speaker. Tama ba? Oo, okay. Kayo, hindi kayo speaker, so in other words, hindi kayo naka-project doon sa output. Tama? Okay. Sige. Maglagay ka na ngayon ng video. Ipakita mo yung video yung pinadala ko sa'yo, yung dalawa. Hindi. Pinadala ko ngayon sa WeTransfer. Download. Sige, Sir Vera na lang, Sir Vera. Para makita din ni Ivan.
Clearly higher in patients with COVID-19. It was 15% as compared to 6.9% in the control group. However, we analyze if these antibodies were associated with thrombosis in these patients with COVID-19, and certainly no association at all between these antiphospholipid.
Lang po yung naririnig sa output, Doc.
Marlon?
Ayan na, Doc. Naririnig na kayo.
Ay, hindi. Huwag mo ako lagay sa output. Naririnig ako sarili ko sa output. Bakit? Kasi nilagay mo ako ulit sa panelist. Siguro, doon sa webinar. Attendee? Dapat lahat na. Saan ko ba in-mute? Okay. Sige. I will figure that out. So you have to give instructions. Kasi gusto ko marinig yung ano ni Sir Vera eh.
Antibodies and the thrombosis that descend.
Sige, magsalita ako. Yan. Ay, hindi naririnig. Ba't kaya? Ba't kaya, Marlon? Alin? Ano lang. Oo. Mhm. Hindi ba dapat ikaw nag-mute nun?
Question, kuya. Di kaya dahil hindi naka-headset si doktora sa input?
Doon ba sa webinar? Doon ba sa webinar, participant, attendee ako or panelist? Sigurado ka? Dapat lahat. Doon sa webinar, dapat lahat attendees at saka lahat na attendees naka-mute. Dapat walang audio. Ano yan? Walang audio, walang video.
Ganun po ako ngayon, Dok.
Robel, naririnig mo ba sarili mo sa sa webinar?
So, wait, Dok. Parang hindi. Hello. Hindi, Dok. Ay, mahina lang. Faith.
Naririnig kita sa webinar. Robel, naririnig kita sa webinar.
Eko din, Dok. Sa akin, Dok, ngayon, medyo malakas, Dok, kasi dalawa na ulit yung ginagamit kong mic. Ginamit ko na yung mic ng mic ng input. Pero Dok, pag yung isa yung yung ang ginamit, ang nakasuksok lang sa tenga ko pala, Dok, is yung sa output. So medyo malayo yung mic ng input ko. Faint lang yung boses ko, Dok.
Pero hindi pa rin dapat. Hindi pa rin dapat. Ganito na lang. Siguro pag hindi basta instructions mo will only be for the panelists dito. But everybody please mute and no video. But you can converse on chat. So conversations here will just be on chat. Sa input. Pagdating ng interactive, that is where the ones who are involved in the interactive will have now their. Can we practice that now? Okay. Kunwari, you are all attendees on the Zoom. Attendees kayo lahat sa Zoom, ha? Sa output, we are all attendees at the output. Walang output, all attendees at the webinar output, and then how do I do that? Okay. So what we are viewing now are can we start? We'll
some
start
of
with the
these
recording.
COVID-19
Sige. So, unahin na natin, ang program will be, everything is recorded, prayer, pambansang awit, yun ang sequence, ha? Nandiyan yung program sa inyo. Okay? So, prayer, pambansang awit, and then introduction, also recorded by JLY. So, upload mo na lang yan, project. And then the 3 recordings. So, Vista, Cervera, and Bonpa. Pagdating ng... Can we just go into that sequence? I will do it in chat, huh? So, okay, so everybody now stop your video and stop your audio.
Kaya Marlon, pag nag-record ako sa Zoom, paano ko mahihiwalay yung video ko? Oh. Yes. Speaker dapat. Okay. Follow host view. Okay, okay.
And there was no association with thrombosis. And also there was we can say that COVID-19 thrombosis mimics in some way the antiphospholipid syndrome, even the catastrophic antiphospholipid syndrome, but it is not clearly an antiphospholipid syndrome. However, very interestingly, what we did in addition, in this study, was to compare the levels of the beta-2 glycoprotein 1. You know, the beta-2 glycoprotein 1 is the cofactor of the antiphospholipid antibodies. Well, we compared the levels of this cofactor among the three groups, among the COVID-19 patients, also the control group, and also blood donors from our blood bank. And very interesting, as you can see in this slide, much lower levels of beta-2 glycoprotein 1 levels were detected in COVID-19 patients as compared with the blood donors or with the control group that we analyzed in this study. So probably what happens is in these patients with COVID-19 is something that already Pierluigi Meroni, Angela Tincani, Laura Andreoli already hypothesized a few years ago, is that increased apoptosis leads to the consumption of beta-2 glycoprotein 1. And this consumption of beta-2 glycoprotein 1, these decreased levels of beta-2 glycoprotein 1 also leads to thrombosis. So this journey, this pathway between infection and thrombosis in COVID-19 is probably mediated by the hyperinflammation, the systemic inflammatory response that appears in these patients, the increased apoptosis that appears in these patients, also some level of hyalinization, and also hypoxia, thus leading to thrombus formation. But this happens just in some patients. Not all patients certainly present this. Probably it is required some, let's say, thrombotic phenotype. And now let's see the clinical features of this thrombosis associated to COVID-19. And what we realize very soon is that this COVID-19 coagulopathy shares many features with the other microangiopathies, and also many laboratory features, increased levels of ferritin, D-dimer, LDH, troponin, and so on. And as you can see in this table that was published by John Merrill and Doru Kerkanen and other colleagues, that comparing the features, the clinical and laboratory features of COVID-19 thrombosis with the other microangiopathies, with catastrophic antiphospholipid syndrome, with hemolytic uremic syndrome, atypical hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, disseminated intravascular coagulation, you can see that they share many similarities. And this leads to probably what is more important, is the treatment. And as these authors already stress, these thrombotic events in patients with COVID-19 has certainly treatment implications. And the main treatment implications is that we need the use of heparin. And heparin is very important because it is not just an anticoagulant. We already know from previous studies that heparin has much more effects than just an anticoagulant. It inhibits inflammations, it inhibits the platelet activations, it inhibits neutrophil recruitment, it inhibits angiogenesis. So many of the pathophysiologic mechanisms that we show you at the beginning of this talk that have been implied in COVID-19 thrombosis certainly are inhibited by heparin. So heparin was quite soon used in patients with this thrombosis, and this study coming from China certainly confirmed that the use of heparin was associated with a decreased mortality in severe COVID-19 patients. And that's the reason that also very soon the International Society of Thrombosis and Hemostasis produced these guidelines for the management of coagulopathy in COVID-19 patients that for sure have saved many lives. So we can conclude that venous, arterial, and microcirculation thrombosis are common findings in patients with severe COVID-19, that multiple mechanisms have been involved in the pathogenesis of thrombosis associated to COVID-19, and that the antiphospholipid antibody beta-2 glycoprotein 1 pathway is most probably involved in some way in the pathogenesis of thrombosis associated to COVID-19. And for sure, the prompt use of anticoagulant therapy, heparin, of course, is of paramount importance in patients with severe COVID-19. Thank you very much for your attention.
Binuksan ko sa, if you will look at the chat, so I will now, what the instructions will be at this point, when you finish, buksan na kaagad yung video. If you will look at the sequence on chat, so that will be number 2. So sequence 1, all recordings, prayer, national anthem, everybody is muted. And then And then pagdating ng number 2, which is now live panel discussion, I will do the screen share like what I'm doing now, example. And during that time, I will now open my audio and video. Okay, so I will now open my, okay, kasi ako ang magsasalita. And during this time, we will instruct now the panelists to close their, anyway, wala na kasing point for you to have the recording. There's no more recording being done here. Somebody will just, or at least, kailangan yung output at this time, give instructions for the panelists para walang feedback. All the panelists, someone please take down notes, pati yung mga instructions. So all panelists will mute their output. In other words, silent or mute their output. Wala dapat, like what I'm doing now. Okay, so yan, wala na feedback kasi minute ko yung aking computer. All right, somebody's taking down notes. Danilyn and Peter, can you type in the notes para alam exactly ni Marlon on what to do at this point. Okay, so if you will see here, what I am showing here is that prayer, Philippine National Anthem, introduction, these are all recordings. And then for the plenary lectures, all recordings, Lupus and COVID-19 by Vista, hypercoagulability conundrum in COVID-19 infection, Cervera, and then antibody response to SARS-CoV vaccine in lupus, Bonfa. Pagdating sa panel discussion on the practice points, you will also note there, doon sa aking nilagay sa chat. By this time, turn on Navara. So all the panelists will be turning on their audio and video and make sure that their output is silent. So makikita lang sa output will be just the chat or the Q&A. So somebody will be monitoring that. One of the fellows help me out also, ha? Para maano nyo dun sa Q&A, somebody is, bakit nakikita ko yung chat doon?
Dok, yung sabi ko kanina, wag pong magchat-chat to everyone dito sa input kasi lalabas po dito sa output. Kasi kung ano po yung screen ng input, yun din po yung lumalabas sa output. Kaya Dok, kailangan walang magchat-chat to everybody or kay Kuya Marlon po.
Bakit hindi mo na lang gawing webinar itong input?
Dok hindi upgraded tong input Zoom natin.
Okay. Bakit hindi mo gawing webinar ang input para may choice dyan na mag-chat ako to panelists only? So I have a chat to panelists only.
Lalabas pa din po yun, Dok.
Hindi nga. Mahirap i-control yan because you have a lot of panelists here and you have speakers and you will have, so yung parang ginagawa natin usually in any webinar. So if you make this into a webinar, nakalagay dyan na participants are divided into attendees and dito sa sa input. So you attendees and panelists. So nakalagay dyan, so if I look at now the chat, I have the option to chat to panelists alone. para panelist alone and not to all. Para hindi lalabas doon. Check nga natin. Okay. Para hindi nakikita doon. Para ang nakikita sa output in the webinar itself will only be the chat of and the Q&A of the participants, attendees pala. Okay na?
Sir Mark, tinry ko po chat si Dr. Navarra na private. Hindi naman po nakita. So parang kung may group po na panelist, tas parang subgroup ng panelist, pwede ba yun?
Ano, Dok, lalabas siya. Kailangan wag niyong i-chat si Kuya Marlon.
You cannot control that. You cannot control that. So you just invite again, make it into a webinar. Input mo. Yeah, magagawa mo yan.
Wala lumabas sa chinat ko, sir.
Okay. So, hinide mo lang siya. Kasi ikaw nagko-control ng broadcast. Okay? Oo.
Wala pong lumabas. Opo.
Wait a moment. I'm now asking a question on the chat doon sa output. So,
Meron po lumabas na hello.
So lumalabas ito sa output.
Yes po. Hello, what about?
Okay. Pero hindi. So nakikita ko to. Tama ba? Yeah, makikita lang lahat. Tama yun. Tama yun. Tapos if I if I ask a question, or somebody ask a question na, you are all attendees. Somebody ask a Q&A, something on Q&A. Ask a question on Q&A. Are you asking a question on Q&A? O meron bang nagtanong sa Q&A?
Meron po.
Ba't hindi ko nakikita dito sa akin? Paano ko malalaman kung ano ang question nila?
I-click mo po yung... May Q&A button po ba kayo, Doc, sa ilalim po?
Pero dapat... Yeah, pero kunwari ako ang nagmo-monitor. Paano ko malalaman kung sinong may Q&A? Yan. Sige. Doon sa output, can somebody place the names kung sino dapat panelist doon sa output at saka sino lang ang panelist, sino ang attendees. Kasi kung meron mag-Q&A, hindi nakikita ng attendees. Ang nakakakita lang niyan will be the panelist. Output to ha. Sige. Pakisulat naman. Somebody just paste it on Word.
Ako na po, Doc.
Sige. Para ulit-ulitin nyo yung instructions na yan. Para merong assigned na tutulong kay Marlon na ganito, mag-monitor nito, mag-monitor nito. Okay? So somebody monitors also the Q&A. Ngayon, dito sa... Okay. So back again to the program. Again ha, nagkaintindihan na tayo. So from prayer to Philippine National Anthem, introduction, and plenary lectures. Okay? Recording lahat yan. Pagdating dito, instructions, instruct now, somebody places on chat dito sa atin, dito sa chat room ng input. So chat room sa input, somebody is assigned to point out and remind Dr. Zamora, please show your video. So mag-open na ngayon itong mga tao. Navarra, Zamora, Bergantin, Colgante, Bonfa, Lichauco, Ivan Vista. Then turn on your videos. Okay, so turn on your videos is the most important thing. Kasi kayo sa panel discussion. But somebody will spotlight dito. Ang unang spotlight, kasi baka may slide si Zamora, ako ang mag-i-screen share. So I have a copy of all their slides. They will submit that to me. Mga key slides lang. And then they will submit that to me. Ako na ang mag-i-screen share. Coming from my end. Okay? So I will screen share. And then Zamora, habang magsasalita ngayon Zamora, I will ask him, can you explain your slide? Talk more about the slide. Sige, spotlight ngayon kay Navarra at kay Zamora. O kaya kay Zamora lang. Basta whoever is speaking, spotlight na doon. Tapos pagdating dito, spotlight on Bergantin, Colliante, and Bonfa. Dito sa slide na to. So Bergantin, Colliante, and Bonfa. And then pagdating dito sa topic na to, keeping the balance, continuing challenges, spotlight on Lichauco and Vista. Okay? So again, will you place that on Word? Transfer this on Word. So you have it on chat, transfer this also on Word para the instructions are clear. Para may pinaghahawakan lahat na tao who are on the technical background. Okay? Pagdating dito, so at the end of all these individual presentations, spotlight on everyone here. So spotlight on all the people here. Navarra, Zamora, Bergantin, Colliante, Bonfa, lahat sila. So you will have 6 people, I think. 6 ba lahat yan? Pati si Vista. Because ano na yan? Comments na yan. So magpo-comments na lahat yan. Including now the open forum. During this open forum, if there's any Q&A, I'm not sure I will be able to follow what is on Q&A kasi lalabas lang yan sa output. Paano ko monitor yung Q&A? So somebody will have to help me out on that. So kung pwede, well, you can, yeah, somebody just helps me out that without, para lang makikita ako. Marami sa kanila, mag-ano sa chat. Makikita ko yon, di ba? Pag nag-chat sa output. Okay, so
Yes,
makikita
po.
ko dapat yan. Okay. Pero ang Q&A, ang hindi ko makikita unless I'm panelist. But I cannot be monitoring this. So just in case, if one of the fellows can be there just to monitor. Okay? Para just to monitor kung ano ang mga lumalabas, were there any questions that were not answered, para i-remind lang ako or send me a message here on the input. Alright? Tapos pagdating dito, focus na kasi baka mukhang mukhang walang recording ito. So, we will now close our videos and our dito, and then si JLY ngayon ang naka-spotlight. So, the panelists will now close your videos and your audios, except for JLY. So JLY na lang ang naka-spotlight. I don't know conversion slides, but I don't think she will have time to record this. So this is also live. Ito na lang ang mga recording. So pagdating sa recording, meron ka nito, no? Using UST him. Pwede naman tayong doon na lang sa UST him. Sige. Okay? So, nakita nyo na yung, yung sequence. Okay. Marlon, are you okay? So Marlon, Rebel, may kanya-kanya kayong assignments on this. You have specific assignments and each of the fellows will have specific assignments. Ivan, you want to, paano mo ba i-record? Paano ka mag-zoom? Are you going to, paano nyo i-zoom record si Ivan? Sige. So, Ivan, okay ka na, Ivan? Modis na siya. Okay. Okay na tayo? Are things clear now? Much clearer?
Yes po.
Ang gawin nyo na lang, I may not be able to join you tomorrow evening, but I think may ini-schedule si JLY para aware siya on this. So by tomorrow evening, ano na yan ha? Refined na yan.
Doc, for the yung Q&A po, mag-share slide po ba kayo? Kasi maliliit yung video sa side pag may naka-share na slide po.
I'm not sure what.
Pag ganito po kasi may naka-share screen, Doc, maliit lang po sa side kayo, Doc. Hindi po yung parang kanina na videos po lahat na nag-occupy ng buong screen.
Ang lang naman, ganito.
Apa, ganyan na lang.
Yeah. So what I will do is pag merong nag-share ng slides, I can unshare if I already have, for example, let me open a, for example, hanap na ako ng isang, okay, kunwari, okay, so i-share ko na yung slide ko. Kunwari ito. So paano ako lumalabas?
Maliit lang po sa side, Doc.
Yeah, ganun lang actually. Yeah.
Okay.
So kung meron nagsasalita habang nagpro-project ng slide na ganito, kung meron nagsasalita, makikita ba? Kunwari, nagsasalita ako. Sige. Yung kanina.
Sir Marlon, pwedeng pa-zoom out po doon sa output?
Yan.
Ayan po. Ganyan po.
Tanggalin mo na, pwede mo tanggalin yung roadshow, yung Lupus roadshow sa tabi. Ang ipakita mo na lang yung pakita mo na lang yung picture ko at saka yung certificate of appreciation slide. Alisin mo yung sa isang side. Yeah, masyado pa nag...
Doc, ganyan po pag dalawa po kayong naka-spotlight and then may naka-share, Doc.
Okay, yeah.
Okay lang po.
Yeah. Okay lang yan. Hindi naman kailangan. Basta ang importante na focus dito will be the slide.
Okay po. Pero yung
And
na open
pero
for...
pagdating na ngayon na lahat, tatanggalin ko na itong screen share.
Okay po. Noted.
Kapag nagsasalita na lahat. Kasi konti lang naman yung mga slides nila. Konti lang yung slides. So habang naka-project yung slide nila, yung slide ni Zamora, siya lang o kaya kami lang dalawa. Pag naka-project na yung part ni Bergantin on the vaccine and other frequently asked questions, so si Bergantin, Collante, and Bonfa. At saka ako. So bali 4 kami ang spotlight mo. Okay? Tapos pag naka-project ngayon si doon na sa third part, yung tipping the balance, ang naka-project ngayon, ako, si Lichao po, at saka si para na to.
Dr. Ivan.
Yeah, Dr. Ivan. Alright?
Noted.
Okay. Tapos pagdating yun, i-unshare ko na. And then, all of us will be on the screen. So, tatanggalin ko to. Stop share. Sige. So, 6 na ngayon ang makikita ko dyan. So, we'll have a discussion and then we'll have the Q&A.
Ma'am
Okay?
Robel, pwede pa-open ako. Try ko po yung 6.
Try mo nga yung 6.
Apo. Ma'am Robel, pwede pa-open sa inyo. Pit, ayun, last. Ayan, kumpleto na po.
6 na yan, no? Tama ba?
Yes po.
6 ba yung names?
Yes, Doc.
So, we have some more. 2, 3, 4, 5, 6. Okay. Yeah. 3. 6 or 7? Sige nga.
7. Sir Marlon, pwedeng pa-on sa inyo po.
So okay. So we have count again. Can you count? Can you count from the program? So we have Zamora, Bergantin, Collante, Bonfa, Lichauco,
7.
7 nga.
Okay.
Maalanganin ano ang spotlight mo?
Ganyan po yung ang itsura, Doc, sa output.
Oo nga.
Pag
How
mas
do you-
lang po, mas malaki.
Wag mo nila ako ipakita. O wag mo na ako ilagay sa spotlight.
Okay.
Pwedeng wag mo na ako i-spotlight
Okay po.
pag doon na sa panel discussion.
Yan.
Pero naka-on lang yung video ko. Naka-online siya pero wag mo ako i-spotlight. So bali ano yung spotlight. Ngayon, pag natapos na and I was going to make the, for example, summary, okay, thank you very much. So I'll do the thank you. At saka mo nila ako i-spotlight.
Okay po.
So by that time. When I say thank you and I end the panel discussion, just put back the spotlight. Okay?
Okay po.
Sige. Wendell, mataas pa rin blood pressure niya?
And 140/80 po yung latest. After,
Just watch out for the, watch out, pati yung output niya.
yes, but Doc, I gave 5 milligram po from Lodipine kanina, nung 150/80.
Yeah, kung magtataas pa rin siya, tsaka she doesn't feel good with the pulse. Tomorrow you can we give a 250?
250 po tomorrow. Yes po, Doc.
Ano mo 250 na preparation?
501 gram.
Parang wala eh.
Okay naman po, Doc, so far. Wala pong complaints.
Yeah, but she places the insomnia before pag high dose steroids. Sige, just watch it.
Yes po, Doc. Tomorrow na lang po, Doc.
So kung tomorrow, ano mo na lang, commercial side effects, and then just let me know.
500 pa rin.
Or we can adjust. So we can adjust the dose, or we can even switch to dexamethasone. Smaller dose. Okay. Ano daw? Wala pa ba si Heidi? Wala pa si Heidi, Marlon? Ha? Hindi. Practice ko lang siya. O, so nandiyan na siya kanina. Sabi mo sa kanya, bilisan niya. Gusto ko siya makita. Hindi ako mag-out hanggat hindi ko siya nakikita. Sige, mag-usap na kayo. Mag-mute na muna ako para hindi ko kayo pakialaman dyan. I saw your earlier slides, by the way. No, I will need that. Na-perfect nyo na ba yung slides nyo?
Doc, present na lang po namin. Then, opo.
Can you present
Kasi
lang?
hinihingi din po ni Doc Jombi. Sabi ko
Okay.
mag-present today, then i-send po namin yung final.
Okay, okay. Somebody please summarize on Word yung sequence natin para masundan ni Marlon.
Okay po.
Or everybody follows it. Just place it on Word so we can send to all. Exactly, exactly how the sequence should be. Kung saan naka-focus, tapos and who is in charge.
Okay.
I-represent. Yes.
Okay, present.
Okay. So good morning, good afternoon, doctors. Presenting you our study on clinical characteristics and outcomes of COVID-19 infection in patients with systemic lupus erythematosus, a single center experience.
Ay, sorry.
Okay. So we have a total of 100. Saan yung first slide? Diretso na lang. So showing here are different tables. First would be on severity and outcome of COVID-19 infection in SL patients. We have a total of 6 patients, 2 asymptomatic, 26 with mild COVID infection, 2 with moderate, and 6 with severe to critical. For the outcome, we have 34 patients who recovered, and of which 13% were hospitalized and 2 died. With regards to immunization status, we have 29 patients with no vaccination, 3 had incomplete, and 4 are fully vaccinated. The mean number of days of interval vaccination to COVID-19 infection would be 11 days for incomplete vaccination and 80 days for patients who are fully vaccinated. And most of these vaccines are inactivated mRNA and mRNA platform. Showing here is the association of SARS-CoV-2 immunization status with severity and outcome of COVID-19 infection. As you can see here, there is no significant, the values here are not statistically significant. However, those patients with no vaccination had a ratio of 1.3, having a mild infection, COVID-19 infection, and 1.6 for fully vaccinated. Here again is the association of SARS-CoV-2 immunization status with severity and outcome of COVID-19 infection. So again, the values here are not statistically significant. However, for those patients who are not vaccinated, the odds ratio of being to recover but not hospitalized would be 2.2 as compared to those who recovered but hospitalized at 1.33. those who have incomplete vaccination, the odds ratio of being recovered but not hospitalized would be 3.1, and 4 for recovered but hospitalized. Next, please. Ay, kulang pala yung slides. Mayroon pa akong latest, yung
Ay, i-share mo?
yung relative risk.
Okay. Wait lang.
Hindi ko na-send sa'yo. Oh my God, sorry.
Yun ba yung sinend mo kanina na dapat for ano pa? For
Oo.
correction? Hindi ko pa
For correction pa.
Okay lang, okay lang. Whatever you have, whatever you have.
Okay po.
I-share mo na lang.
Hindi ako makashare.
Sir Marlon, pwede pong paano? Ano ba? Multiple. 37. Ayan, pwede ba?
Ayan.
Okay.
Siyempre. So this would be the latest, Doc. We calculated the risk for death, hospitalization, and severe to critical COVID-19 infection among SAE patients by vaccination status. So we have a total of 36 patients, 49 of which were unvaccinated, and 7 had partial or full vaccination. So the relative risk for those patients who are unvaccinated, those who are unvaccinated SLE patients are 30% and 26% more likely to have severe to critical disease and die of COVID-19 respectively than SLE patients who are partially or fully vaccinated. So with regards to the risk for hospitalization, those who are not vaccinated have 14% less the risk of hospitalization compared to those who are partially or fully vaccinated. And lastly, those who are not vaccinated have 25% less the risk of having mild to moderate COVID-19 infection compared to those who are fully or partially vaccinated. So this would be our sample calculations and the conclusion.
Share ko na yung kay na Vince.
Hello, Doc. Good afternoon po. Doc, instead po of autoimmune phenomenon po, it's ano po? It's immune mediated.
Yeah, change that later. Okay, show it.
Immune mediated.
Sige, okay na. Change that later.
Yes, Doc. Okay. So out of 109 patients, Doc, we had a total of 6 patients who had a new onset of an autoimmune reaction, and then the other 5 had this disease flare. So for the first patient, a 27-year-old male, previously healthy, and after a vaccination, first dose of a viral vector vaccine, a patient developed new onset of clinical amyopathic dermatomyositis 1 week after. The patient was given steroids and methotrexate and noted improvement. Another patient is a 19-year-old male with spondyloarthropathy in remission after 1 week of inactivated vaccine. second dose, patient developed severe back pain, which resulted into disease flare. And then after that, the patient methotrexate was resumed and noted to have improvement thereafter. Third patient is a 56-year-old female, SLE in low disease activity. She was given a viral vector, and after first dose of this vaccine, 3 weeks after, the patient had severe cutaneous flare. Patient was given steroid and noted to have improvement thereafter. Fourth patient is a 57-year-old female, SLA in remission. She was given an inactivated vaccine, and after second dose, 4 weeks after second dose, patient developed cutaneous, hematologic, and renal flare. Patient was given steroids and noted to have improvement as claimed. Next patient is a 72-year-old female, rheumatoid arthritis patient in long remission. She was given an inactivated vaccine, and after 10 days post a first dose of vaccine, she had an atypical arthritis flare. Patient was given steroids and was noted to have improvement thereafter. And the last patient is a 57-year-old female, a rheumatoid arthritis patient in remission. She was given an mRNA vaccine, and after the second dose, 4 weeks after the second dose, patient had a disease flare. Steroids was given and noted to have relief thereafter. So here is our case report pertaining to the 6 patients who developed an immune-mediated disease flares, a new onset disease following vaccination. First patient is a case of, it is a new onset clinically amyopathic dermatomyositis following SARS-CoV-2 vaccine. A 27-year-old male, previously healthy, and 1 week after post-vaccination, he developed malar rash involving the nasolabial folds. Patient also had heliotrope rash, Gutrons and Holters, arthritis, and myalgia. Laboratories revealed elevated ESR, NA positive, and anti-RNP positive.
The second case is a 56-year-old female who has SLE with low disease activity, maintained on low-dose steroid prior to her COVID vaccination. She received her first dose of a viral vector vaccine. Then 3 weeks later, she started experiencing itchy scalp with beginning erythematous patches on her thighs, which gradually spread to her legs, abdomen, and upper extremities. On workup, she was noted to have hypocomplementemia and elevated anti-dsDNA. Skin biopsy was also done, which revealed interface dermatitis consistent with lupus erythematosus. Her steroid and methotrexate were increased and was given topical steroid for the skin lesions, which resulted to gradual resolution of rashes.
So this is a case of a 57-year-old female on long-term SLE remission. She was fully vaccinated with an inactivated vaccine, and after 2 to 4 weeks of vaccination, there was onset of cutaneous flare presenting with alopecia, rashes, and oral ulcers. There was also noted hematologic flare, which revealed a hemoglobin of 86, and renal flare revealing urine albumin of 4+, RBC of TNTC plus cells of 5 to 10. So this is, in summary, this is a case of a patient of cutaneous hematologic and renal flare following SARS-CoV-2 vaccine, a lupus patient in a long-term disease remission. So a patient, as at present, the patient is on steroids, and the rashes have already resolved. Currently working up the patient or treating the patient for the renal flare. Vince, nakamute ka ata.
Ay, sorry, nakamute pala ako. Another case is a case of a 72-year-old female diagnosed with rheumatoid arthritis in prolonged remission. Patient was given an inactivated vaccine, and after 10 days of first dose, patient experienced painful swelling of both hands, right more than the left. Patient was given with steroids, and she noted to have a relief thereafter. This case is a case of a 37-year-old female diagnosed with a seronegative rheumatoid arthritis since 2018 and in remission. Patient had already received 2 doses of inactivated SARS-CoV-2 vaccine. However, after post-COVID exposure, she developed sore throat and painful swelling of the joints and rashes. A patient had undergone RT-PCR, which showed a positive results. A workup was done and revealed elevated C-reactive protein, normal ESR and CBC, negative RF and anti-CCP. Upon recovery, the patient's swelling and rashes resolved as claimed.
Doc, that's our last slide. Receive, develop. Delete unnecessary words, receive, develop.
Dan pa-delete na lang, sorry.
Okay.
2 doses na lang dan.
Okay. So you do that on your own, and don't send directly to. I will choose the ones to send Dr. Dichaco.
Okay po, Doc.
So don't send, because I'm not going to send these pictures. These are not yet published. You also every slide should have a reference, huh? Kung sino ang author. You saw that. Every slide underneath. O sino ang author nito? Sino ang author nito? Sino ang author nito? Ba't wala kayong mga author niya? Kasi iba-ibang case report yan eh.
Yes, Doc.
Tapos ilagay nyo dyan sa yan, dami nyo pang kailangan gawin. You have can you streamline your dami nyo pinaglalagay dyan. Yeah, remove anything that's unnecessary. Remove all the unnecessary things. Also, you don't say obtain permission. Kakainis kayo, mas maganda yung pinagsasabi nyo nun. You had that in one of your slides that you said patient provided consent to use photos for medical education. You obtain permission. Sige, na-imagine nyo na mukha ko. Sige, let's do that on our own. This is supposed to be just a technical for
Yes.
the Marlon, Rebel, and you work on this offline on your slides. You need to refine your slides. Again, reminder, do not send anything directly to Dr. Dichaco. I will choose the ones to be sent. But you'll have to refine your slides.
Okay po.
Okay. Marlon, can we have a rundown again on the technical, just to review things to do, action items, who is in charge? Did somebody place that already on board?
Ako po, Doc.
Okay. Sige, lagay nyo dyan kung ano nakalagay sa Word para ma-review.
Sequence number 1, all recordings.
On Word, can you share? Share para nakikita ng lahat, and then we can just we can revise as we get along.
Okay po. Share.
You all have a copy of the program, no? Grabe, naka-red lahat.
Sequence, all recordings, prayer, national anthem.
Pakilaki, palakihin mo naman. I can't see. Now you'll have to do this point by point. So you will have, for example, prayer, how many minutes? So number 1 will be prayer, and then down next bullet, national anthem. Next bullet, intro. Next bullet will be recording, anong title. Next bullet will be, so all of these are recordings. Okay. And then next bullet, so that has to be one by one. Okay. The way I did it with you, I reviewed that with you, okay? So you'll have to go point by point para maintindihan natin. And then meron kang comments on the side, so spotlight. So ito yung program as I shared with you. So this is the program. So what you do for each one. Sige, can you unshare that and then do that offline on the side? You copy this exactly the way. Okay, prayer. Okay, so after the prayer, lagay mo lang dyan R. So recording, Philippine National Anthem R. Tapos dito R. Tapos pagdating dito na plenary lectures R. Huwag mo na ilagay yung plenary lectures. Basta lagay mo, plenary 1, plenary 2, plenary 3. Para kunwari nasa backstage ka, itong mga like sila Marlon, Robel, they're all backstage. So they know exactly, pasok, pasok, pasok. Tapos pasok, pasok, pasok. Hindi na nila wala silang pakialam kaya plenary lecture yan o panel discussion yan. Okay, basta nakalagay sa side R, 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 R. So from the backstage, from the technical, all they are concerned about is kailan ko ito i-upload, kailan i-show. Okay, pagdating dito, so you now have intro. So next will be panel discussion intro. And then, so live na lahat yan. So lahat ito, so put in a space between this first part, this is all recordings, and this next part will be, are you doing that now? Are you
Yes.
transferring all this? Okay, on Word. So this next part is all live. So from all live thereon until summary and acknowledgements. And then again, recording na to prayer at saka UST. Okay, so you'll have to segregate that. Para kung ikaw, wala kang pakialam sa scientific, basta ang pakialam mo lang is ang lalabas sa webinar. And that is Marlon's role. Wala naman siyang pakialam kung anong content eh. Ang pakialam lang niya is lalabas na maganda for the attendees. So Marlon has to know exactly kailan, anong ilalagay niya dito. So ito, all recording. So you'll have to go one by one. Hindi naman siya magre-record ng plenary lectures. Ang i-record niya is plenary 1, which is by Vista. Plenary 2 is Cervera. Plenary 3 is by Bonfa. So, lahat yan. Meron siyang mga recording ng kanya-kanya. So, alam na niya ang sequence sa recording. Pagdating dito, live. So, doon sa live, meron ka ngayon instructions. So, instructions exactly. Anong instruction ang ibibigay mo doon sa panelist? So, turn on your video. Nakalagay dyan. Kasi ito yung backstage instructions eh. So, pagdating dito, live, L-I-V-E. So, in other words, instruct. So, instruct, Luis, sandali. Tama mo ulit. So, instruct now your, gulo talaga ni Louie. Okay, so instruct now, live na to, itong portion na to from this time is live. So nakalagay dyan, backstage. Backstage. So backstage instructions is kung sinong magbibigay ng instructions doon sa, so dapat merong nakasubaybay doon sa mga panelists na to. Turn on your videos. Turn on. So all the panelists will turn on their videos. So Navarra, Zamora, Bergantin, Colliante, Cervera, hindi makaka-attend. And Bonfa, and Lichauco, and Vista. Turn on your video. And then, nakalagay dyan is, pagdating dito, so all will turn on the video. Then, dito sa introduction ng panel discussion, may kang instruction. Navarra, turn on video and audio. Pagdating dito, so pagdating ng panel discussion, live ha, all these 7 are going to turn on their video para madali na silang spotlight pag nagsasalita sila. So that's the point there. Pagdating dito sa intro, spotlight Navarra and turn on your audio. Okay? So Navarra ang mag-audio kasi introduce ko yung mga speakers eh. Again, your instruction to Navarra will be turn on video and audio. Pagdating dito. So pagdating again, live, panel discussion. Ang mag-instruct, Navarra, Zamora, Bergantin, Colliante, Bonfa, Lichalco, Vista, all video on. Then, sa panel discussion intro, Navarra, video and audio on. Pagdating dito, and Navarra, video, audio on, share screen. Navarra yan, ha? And then, pagdating dito, pag sinare ko na yun, pag sinabi ko na yung 2 slides, okay, then may I now ask Dr. Zamora to comment? And then, Dr. Zamora now will have, bigyan mo instructions. Doc, turn on your audio. Doc, nakamute ka. So, unmute. Ganun na lang, unmute. Or mute, unmute. So, you have to have the instructions simple. And that will be on chat. Yung chat na yon dito sa input, hindi dapat nakikita ng output webinar. Okay? So, nandito, pagdating dito ngayon, alam naman ni Zamora na lagyan na lang niya sa mute ulit kasi hindi siya magsasalita dito. Dito lang, remember during all this time ha, lahat kaming 7 will have video on. Pero pagdating na turn na nila magsalita, mag-unmute na lang sila. Okay? Pag turn na nila magsalita, depende sa slide. 1 set of slides lang ito na i-share ko. Mag-unmute ngayon si Lichalco at saka si Vista. Pagdating dito sa open forum, summary of all that, okay? So this one is all 7 will have video, audio on, screen share off. So stop screen share. Got it? So you have to be very specific on that. Para pag kunwari yung panelist hindi nakikinig or whatever. So kung hindi nakikinig, wala siyang guide. The panelists will have their guide ha. Bibigyan natin ng guide kailan sila mag-off, on, off, on. Okay? Then pagdating dito, pag natapos na yan lahat, so all, so screen share off, stop screen share, then spotlight all 7, all 6 pala, all 6. Pag may spotlight kay Navarra. So 6 lang ang spotlight mo dito. Tapos, once na, you'll have to add another thing here is conclude, summarize panel discussion. So put in another portion there. And then nakalagay dyan will be spotlight Navarra. So pag lagay dito ng panel discussion, all, screen share off, and then spotlight 6, all the 6. Okay, pero pati si Navarra naka-unmute. Okay. And then you'll have here the summary. Pagdating dito, add in a portion, another bullet na lang for the backstage people. Another bullet that says summary of panel discussion, spotlight Navarra. So spotlight Navarra only. Okay? Pagdating dito, lahat ng panelists, all 7 of us, should be, again, you will now mute, all 7 of us will now mute, pero video on pa rin. And then we will have Julie will be spotlighted. Okay, so hindi ko alam kung meron siyang slides, baka wala. Pagdating ng slides, pwede naman ako ang mag-project. Pwede ako mag-screen share. Got it? Okay, sige. Gawin na yan. Gawa kayo ng draft ng Word and then pakita natin kay Robel at saka kay Marlon kung naintindihan nila exactly kung saan sila saan papasok ito. At saka somebody will be monitoring and giving instructions on chat to the individual panelists and presenters. So yung live ang maraming gagawin yung mga fellows in terms of making sure na alam exactly kung saan papasok. Remind the panelists, Doc, pasok na kayo. Doc, paki-unmute. Doc, paki-mute. Doc, paki yung video nyo. So there is to be somebody who is going to give instructions on chat to the panelists. Got it? Hindi si Marlon ang gagawa niyan, hindi si Robel. Okay, so Marlon and Robel and Heidi or whoever will be talagang nandun sila sa mga technical aspects. But somebody will have to be chatting to the panelists. Exactly, alam nyo kung anong sequence. Fellow yon. Okay? Sige. Okay na tayo. Tapos, padala nyo yung slides nyo sa. Okay na? Anything else? Marlon, are you still there? So, Marlon, is there anything else that you need from the fellows and from us? So, all the videos, ikaw in charge dyan. Just make sure you have a complete set and then it's going to project very well. Tapos gagawa ng Word. Ready na ba yung Word mo? Gusto mo na ipakita ngayon? Gusto mo i-share hindi? I'm talking to Danilyn. Danilyn, ready ka na?
Doc, hindi pa po. Nireset ko kasi yung laptop ko, Doc. Nag-phone
Sige.
po ako.
Oh. Wala ba ibang nag-take down ng notes? Okay. Robel, what do you think? What else to be done? We need practice again. You need practice again.
Yes, Doc. Aside doon, Doc, kasi yung naiisip ko, Doc, baka mamaya, Doc, sobrang na focus na kayo, Doc, doon sa discussion. Kung madami, Doc, questions on the chat, sa output to, Doc, output Zoom, sa chat and Q&A, can we assign a doctor na, yung parang ginagawa niyo, Doc, na answer na lang sila ng answer on the questions at the chat?
All right. Yeah, great. Yeah, thanks for bringing that up. Ilagay mo yan sa flow. Somebody taking down notes, kahit hindi na sa computer, kahit sa papel lang.
Ako na po,
Everyone
Doc.
take notes, okay? Kasi idadagdag yung good point here. So doon sa webinar itself, okay, somebody will. So dapat meron kang isang panelist doon sa webinar. Tama ba?
Yes po.
Yeah, so you will have assigned. Sino ba ang magiging assigned na panelist doon sa webinar? Sa
Na
output.
wala pong gagawin dito sa input.
Sa output.
Opo.
Output, you will have output. O-U-T-P-U-T. Okay, so everybody understands ano output. Sino ang panelist lang doon? So you will assign panelists and those panelists will be in charge of answering, monitoring, Q&A, and chat. Para hindi ako ma-burden na while I'm doing the interactive with okay. And then during that time, paano nila sasagutin? Kasama ba sila dito sa panelist dito? Baka
Yun, Doc.
magsasalita.
Kaya,
sila.
Doc, I am suggesting, Doc, na kung sino po yung wala po talagang gagawin na hindi po talaga magsasalita as speaker or moderator. Sila po lang yung ang sole delegation lang po nila is answering the chats and Q&A sa
Yeah,
output
so
para hindi na po sila mag-sign in sa input.
Yeah, I'm thinking of, kasi makikita din naman natin. Yeah, dapat ma-practice din yan, ano?
Yes po. Para ano po nila na tawag dito, ito lang yung makikita nila, so hindi
I
na po
understand
sila
that.
makakaano
So they
doon.
just focus on that.
Yes po.
Hindi na nila hindi rin nila, sasagutin na nila mismo.
Yes po.
Answer it already. Sagutin na
And
nila.
then, opo, parang Doc, kung meron lang kayong mga questions, Doc, total naka-sign in naman din kayo, Doc, sa output. Kung may mga questions lang kayo, Doc, na makikita na gusto nyong i-add sa discussion nyo, Doc, parang hindi burden, Doc, na kailangan pag-usapan nyo, Doc, yung mga nakikita nyong questions lahat. Parang pwede lang kayong mamili kung meron kayong gustong pag i-add sa discussion, pero most po nung pag-answer dun sa Q&A and chat, yung delegated doctor na po. Delegated panelist on the output.
Sino kaya? Yeah, I'm thinking of Lyndon, but who else? But Lyndon will be referring, ang tendency kasi ni Lyndon, baka papasok siya dito sa input. Paano siya? Ang definitely nandito sa input will be the names that who are here. Yun
Yes
lang.
po.
And of course, the staff and the fellows, but you will. Now, who will be the ones who will be answering?
Gusto niyo po ba sila Doktora Sheila Reyes?
Yeah. Yes, at least mga techie sila. Sino pa? Any more suggestions?
Doktora Sheila, Lesa. Sila po yung parati nating na kausap. Tsaka Teki po.
Hindi, Teng is here eh.
Hindi po, Lesa po.
So si Lesa at saka si ano?
Doktora Sheila Reyes.
We will assign them ahead of time.
Doktora Sora.
Oo, sige. Ilagay na lang dyan na sila ang mag-monitor doon. And can you put in the names para sabihan na si Dr. Julie na siya na ang mag-a-assign doon. I will also feed. Siya ang mag-a-assign, yes. Si Sheila Reyes, si Lesa. So Sheila, Lesa, nakatutok lang doon and to answer. Lyndon. Sora. Para na monitor na lang. Tapos ang mag-feed just in case there are any interesting questions. Meron mag-monitor, so who will be in charge of that? Sinong fellow ang one fellow, tapos siya ang magbibigay ng instructions. Sige, pag-usapan nyo. Pero sabihan nyo si Julie, ha? That's the magiging sequence. So who will explain it to Julie?
Dok, ako na lang po.
Nako, Danilyn, hindi nga pwede. Nandito ka na eh.
Ay,
Ikaw na mag-spotlight eh.
opo.
Hindi pwede. There has to be one fellow na nandoon lang siya sa output at magmamonitor ng mga Q&A, magmamonitor ng chat, and magsasabi, Doc, paki-answer nito, Doc. So ilalagay sila doon sa webinar ng output as panelists, whereas the rest are attendees. So as panelists, they're able to monitor the Q&A, and they are also able now to answer the chat. Kasi attendees doon, can only ask questions or can only chat. Be allowed to chat. Yeah, and make comments on chat. We still see. Pero sa panelist, hindi kailangan makita ng kung panelist to panelist lang. Remember, it's a different platform yung kanilang output, ha? So meron kang panelist. Sino i-assign mo sa panelist?
Si Vince na lang po, Doc.
Oh, Vince. Okay, so Vince, naiintindihan mo kung anong gagawin mo doon?
Yes, Doc.
Bibigyan mo ng instructions yung mga panelist mo na, Doc, panelist po kayo, can you just answer? Pero wala kayong audio. In other words, muted. Or even the panelists on the other side will be muted.
Okay po, Doc.
Got it? Kasi
Okay.
wala dapat interaction ng faculty doon in terms of audio. Tama ba ako? So all the interaction of the faculty will be in the input.
Yes po.
Okay. In the output, walang interaction ang faculty. Na in terms of verbal. In terms of audio, walang interaction ang faculty sa audio. Sa output, ha, kasi that output is strictly ano siya, strictly
For
Video?
attendees po.
attendees at saka chat and Q&A
Yes
for
po.
the attendees. That's
Okay.
the output. So that doon sa chat room at saka sa Q&A, merong in charge na panelists. So you have the list of panelists. Sino mga panelists na doon? Vince, ikaw in charge doon.
Okay, Doc.
Kasama ka sa panelist doon. And the panelist will be, so I can view that, no? I can view the Q&A also. Or make me panelist also there. So I can view the Q&A just in case.
Yes po. Dapat panelist din kayo, Doc. Para
Okay.
kung
Panelist
may
ako.
makikita kayong questions.
Pero yung ibang mga panelist, yung ibang faculty, hindi sila panelist.
Hindi na po sila magsa-sign in, Doc, sa output.
Then
Pwede na silang hindi mag-sign in.
magsa-sign in sila as attendees.
Pwede, Doc. As attendees na lang po.
Para mag-view nila. So all of us here will be assigned as attendees. Pero doon sa attendees, doon sa output. Again, put in the names, ha? So again, instructions will be all the people here will also be attendees in the output. Okay, sa output, lahat tayo na nandito ngayon, including the faculty, will be attendees in the output. Did you get that? Okay, so all attendees will be output, except Navarra, who will be a participant in the, panelist in the output. So panelist ako sa output. And in addition to that, the other panelists will be, so I can see the chat, no? So Vince, Sheila, Lesa, Lyndon, Sora. Pero instructions sila sa kanila, hindi sila pwedeng audio. So all muted. Are we okay? So even if they're panelists, they should still be all muted, but their job is to monitor the Q&A and answer if they can answer, and the chat. Did I get that correctly? Tama tayo? Vince, did you get that?
Yes, Doc.
Okay. So ikaw ang in charge dun sa output ng Q&A and chat. Ikaw din, Vince, ang in charge doon sa output na kung sino lang i-assign sa panelist.
Okay, Doc.
And the rest are attendees.
Okay po.
Okay? Ngayon, all the faculty will be given also a link to the webinar and they will be as attendees. They will not be promoted to panelists in the output. So again, instructions, except for Navarra. So Navarra will be the only one there because I'll be monitoring also on how they are responding to that. Clear na ba? Is that clear? Are we okay on that? Rebel? Yes? Yes. Is your yes po? Wag na yun? Magulo na yun? Magulo na yun? Okay lang yun? So dito na lang, entertain na lang natin dito sa chat.
Ano na lang, Doc? Ako na lang, Doc, ang titingin ng comments sa YouTube. Pag meron questions dun, Doc, i-copy-paste ko na lang dito sa chat ng input. Okay lang yun, Doc?
Is it input or output?
Nasa input ako,
Okay.
Doc, on Saturday.
Okay, okay.
Apo.
Yes, yes. So again, place again the instructions on that kung sino in charge sa YouTube questions, ha? Si Robel. Paki-review naman yung inyong guidance on the flow. So everybody, can somebody just place that in black and white para ma-review natin, tapos kung merong mga comments pa from everyone, ay, sandali, na-miss out ito. But instructions again should all be clear. Meron naka-caps, capitalize, all caps, the ones for emphasis, meron naka-red, if ever, so whatever is in the program, at saka exactly to the, down to, I think, let's put in there also let's put there the duration, like for example, how many minutes ba yung prayer? How many minutes yung national anthem? How many minutes yung introduction? How many minutes yung recording ng ni Vista? How many minutes yung recording ni Cervera? How many minutes yung recording ni Bonfa? So,
Okay po,
tayo?
Doc. Yes po, Doc.
Yeah. So, exactly when. Para at least we can also keep track of the time. Yeah, I think we're all getting professional already. Marlon, nagawa na tayo ng ano. Marlon, Rebel, all of you, gagawa na tayo ng ating events.
Mag-bid na nga daw tayo, Doc.
Yeah. Sige. Let's practice it. You're getting every time. You're getting much better every time. Great. Okay na?
Doc, sorry po. Yung introduction po ni Doc Julie is recording po.
Recorded.
Sabihin ko po
I
sa kanya.
already told her.
Okay
I
po.
told her introduction should all be recorded. Kaya this all para hindi nasasakit ang ulo ni hindi sasakit ang ulo ni
Sir
ni
Marlon.
Marlon.
Okay po.
So clear yan dapat. Marlon, okay na? Yeah, at saka, okay, even the timing, ha? Don't forget, Robel is going to be the one in charge of also YouTube. Tapos ika-copy-paste na lang niya dito. Okay, great. It's for the panelists. Okay, and then ako, I will be panelist also on the other side, on the output, para na monitor ko rin. Habang merong sinasagot ngayon ng assigned people there. Can you give instructions? Na si Lyndon will be panelist in the other side, on the output, pero dapat muted siya. Sino pa? So, panelists in the output will be si Lesa, si Sheila, si Lyndon, si Sora. Yeah, that's about it. Sino pa ba? Naisip mo. Okay, so they will have to be, sabihin na lang kay Julie, meet na rin sila to be there. Meet na sila and give them the instructions for this. Okay? Vince, ikaw
Yes,
in charge dyan. So siguro bigyan mo sila ng instructions exactly what to do.
Okay, Doc.
So panelist ka rin sa kabila, sa output. Okay?
Okay, Doc.
Okay. Yeah? Sige. We're okay. So 2 hours from 8 o'clock, exactly 8 to 10. We'll finish at 8:10. Sige. So I look forward to your ito. I-revise nyo na rin to according to the backstage crew. So backstage backstage staff will have exactly for each one. How it goes, how the flow will be by this time. So pagkatapos ng UST hymn, 10 o'clock na. Okay? Sige. Okay na?
Dok,
Okay.
140 pa lang yung registration natin.
Nag-send out na daw si Doktora ng link. Link ata ang binigay ni Dr. Julie Liu sa mga students po eh.
Kaya hindi siguro nag-register.
Opo, nag-text ko kasi siya, tapos sabi niya, I sent out the link to the students already, sabi niya.
But they have to register.
Okay po, sabihin ko to.
They have to register. So, baka yung registration link.
Yes, Doc. I-ano ko na lang po. I-clarify ko to.
Yeah.
Tapos sa Saturday po.
Register. Oo.
Okay.
Okay?
Sa Saturday po, Doc, 7 a.m. po.
Yeah,
call
7
time.
a.m.
Yes
7
po,
a.m.
sige po.
And then Bonfa will be there 7:30. So, para alam niya exactly what's going to happen. So, it has to be 7 a.m. kasi ang dami niyo pang dress out. So, you'll have to do that. I think Julie wants a tech run again on Thursday, but so she will need to be briefed on before tomorrow's tech run. Okay? Okay, people. So bago niya bago siya mag-tech run tomorrow with everyone, somebody will have to feed her already on what happened today. Okay? Ayan, sige, wala na matutulog ha. Priority niyo na yan. May slides pa kayo. Okay?
Thank you.
Heidi, I think you all should have Marlon, Rebel, and Heidi. Can you and ano pa pala ang pangalan niya? Si Kite.
Si Kite.
So si Kite, si Heidi, si Marlon, can you schedule another na kayo lang para pag-usapan nyo on the flow?
Sige po.
Wag na, kahit hindi na kasama ito fellows, kayo lang. So before the tech run tomorrow evening, nag-usap na kayo ulit at pinapractice nyo on how it goes. Okay? Pwede? Marlon, okay, Heidi, Robel, and Kite. Okay. Paki-follow up na rin kay Kite. Send out another reminder.
Sige po, sabihan ko po ulit siya.
Sa PRA? Kasi this is a PRA affair. And they should register. Okay? Okay, thank you.
Okay, Doc. Thank you
Thank you
po.
po, Doc.
Sige, bye.
Bye po.
Bye na ako, wag muna kayo.
Okay po. Stay ba tayo, kuya?
Sige, kayo na mag-usap.
Po. Oo, kuya. Reddish, parang medyo may pagka-purple reddish yung kulay puti doon sa output. Kanina maputi na eh. Kanina pumuti na, tapos ngayon medyo na naman siya, para siyang dirty white na parang may mancha pa. Mancha talaga. Yung parang medyo reddish siya. Dito sa phone ko Kasi dito sa laptop, siya. Sige kuya, go.
Lang ah. Ay, naka-share ako, sir. Iba ba yung color? Prayer recording, Philippine National Recording, Introduction, Dr. Jelway recording. Sir, wait lang ah. Talaga po. Medyo na-confuse ako. Sige po. Prayer recording, Philippine National Anthem recording, Introduction, Dr. Julie Lee recording, plenary lectures, all recordings. Ayan. Lupus and COVID-19 recording, hypercoagulability conundrum, Professor recording. Dapat pala nakasulat recording, sabi ni Doc R. Yan. Antibody response recording, panel discussion, practice points, moderator, spotlight on Dr. Navarra, introduce Dr. Leonid. Unmute, di ba sabi niya? Video on. Unmute, spotlight Dr. on Dr. Navarra to introduce Dr. Leonid. Tapos, anticoagulation for severe COVID-19. Open cam unmute spotlight Dr. El Zamora and Dr. S. Navarra.
Tanong lang, sabay na ba sila naka-spotlight kapag yung time na yan? Or Dr. Zamora muna?
Meron pa tayan, Dok.
5
Meron
minutes.
pang kahit Dok may i-share ba dyan si Dr. Leo?
Zamora.
Dalawa silang naka-spotlight naman, ano? Yung parang
Opo.
ginawa mo kanina.
Opo. So, moderate
Okay.
Zamora. Tapos, ano pala to? Share screen, Dr. Zamora, di ba?
Kasi si Dr. Navarra din mag-share
Ay, Dr.
screen.
Navarra.
Dr. Navarra
Sana
pala.
ata mo SBM na ata
Dr.
mag-share.
Navarra.
Hello?
Yes.
Pagtanong lang ako. Di ba yung may mga questions? Pag may
Mm.
mga questions, ide-direct ko na sa speaker,
Hindi, Dok. Doon sa sa output.
sa output, oo.
Hindi, Dok. Parang ikaw lang ang tagamando, charot. Ang mag-a-answer na, Dok, direkta sa chat tsaka Q&A sila Dr. Llamado, Sora, Sheila,
okay.
and pangalan nito? Lesa. Oo,
Okay.
Dok. Oo. Sila na.
So hindi na magsasagot yung mga faculty, wala na.
Hindi, Dok. Nasa panelist din, di ba, sa output si Dr. Navarra. Pag meron lang siyang makitang interesting questions, sa kanya lang niya isasalay dun sa discussion
okay.
nila.
Okay, sige. So yung question, sila rin yung sasagot.
Sila Dr. Llamado, opo. Pero through chat na lang.
Through chat.
Mm-mm.
So yung gagawin ko, is to it ko na makita nila lahat ng questions.
Yes.
At masagot. Okay.
Yes.
Akala ko sasagot din.
Hindi.
Diyos ko. Oo nga eh.
Output.
Panelist din
Hindi.
sila. Oh.
Hindi. Yung mga speaker natin dito. Hindi, sabi ni Dr. Navarra, yung mga speaker dito sa input, participant lang sila dun, attendees lang sila sa output.
Except sina Doc Sheila, Doc Lisa, Doc Lindon, Doc Sora. Yun.
Sila
Hello,
Dr. Llamado, hindi na sila papasok dito sa input.
Sa output na.
Sa output lang sila, oo.
Yes.
Oo, panelist sila sa output. Bali, lang kuya, parang 6 na tao lang ang panelist mo sa output. Oo. Ililista natin yan kung sino lang ang dapat makikita natin sa output at saka sa makikita natin sa input. Ka-output. Yes. Ay, hindi, kaya kausapin na sila nila ng mga fellow na ito yung gagawin nila. Mm. Oo, oo. Oo. Sana ano, ano, baka ma-instructan kay ano tawag dito. Siguro ang ganito na lang kuya ang bigay mo. Bigay mo kay Doktora Navarra yung Zoom link ng input tsaka output para siya ang mag-i-instruct sa email kung anong papasukan niya. Kung ano ang papasukan nung speaker, nung foreign speaker. Oo, oo. Mm. Oo. Ay, hindi siya makakapag-practice, kuya. Mm. O basta ba, ikaw nang bahala dun, kuya, dun kung paano ang broadcast mo. Basta ang ano lang natin is kung paano lang siya kung paano siya, kung saan siya papasok, 'di ba? Yun ang main na dapat alam ng mga tao. Saan sila papasok, kung speaker sila, saan sila papasok, kung panelist, kung taga-sagot sila ng questions, mga ganun. Ano yan, tawag dito siguro maganda yan kung before the ano, ayun, yung at least tayo, meron na tayong parang email ng information kung ano yung mga delegation natin, 'di ba? Ano kuya, napansin mo ba yung output? Parang ma-red pa rin siya. Oo. Yung ko sa tingin ko kuya, pwede bang maano pa ma, maputi pa ng konti. Ayan, yun kanina. Sige, sige. Sige pa. Sige pa. Mm. Yan. Puti na yan. Ay, ate. Oo, ate, ano tawag dito? Kailangan kuya pag lalambingin mo muna siya para mapapatrabaho mo si Ate Heidi. Ani kasi ko ate medyo madami 'di ba, merong input, may output, may YouTube pa. So sabi ni Doktora Navarra, pag-usapan nating mga staff kasama si Kite kung ano yung mga magiging delegation para kung sino dito, sino diyan, parang ganyan para tawag dito wala yung kumbaga sa kapag pag itong tao dito siya naka-delegate, may naka-focus dito sa isang parte ng yung isang Zoom, yung isa naka-focus sa isang Zoom, yung isa naka-focus sa YouTube, parang ganun. Siguro na lang natin. Ayusin na lang muna namin ni Kuya Marlon tapos para kung Oo, sa virtual yan. Oo, kuya. Mm-mm. Iniwan ka na naman niya. Ayan. Pumunta ka na naman ng ABS? Oo. 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 Kuya, ikaw na ang magla-live broadcast. Ikaw na ba ang mag-sign in ng Roma Center para mag-broadcast sa YouTube? Kasi nasa output ako, 'di ba? Oo, tawag dito, hindi na ako papasok sa input. Hindi kuya, isa lang laptop ko. Isa lang laptop ko eh. Ano ba to? Sikit eh. Ay,
Link ng input sa Saturday.
gagawa pa.
Link to follow na lang. Sige po. Sige po.
Hindi, ito pa rin kuya, ikaw kasi itong PRA na Zoom ang gagamitin natin pang input, 'di ba kuya? Oh, gawa ka ng patay mind ulit.
Input.
Input na lang kuya para madali. Para alam na nila yun kasi yun din naman ang nasa email instructions eh. Input to Lupus and COVID webinar, parang ganun. Let me first to register for Saturday's webinar. Okay. Lupus and COVID. Ay kuya, hindi ako pwedeng mag-output kasi ipapasok ko dito sa input yung mga questions na makukuha ko sa YouTube. Kaya dapat hindi ako mag-output sa laptop. Oo. Mm. Sino pa bang kasama natin dito? Ang alin po? 8 to 10 lang tayo, kuya. 11 ba? Hindi, 8 to 10 lang. Yung webinar natin. Anong oras ba tayo, Dok? Dr. Danny, 8 to 10 o 8 to 11?
Parang 8 to 10 po.
8 to 10 lang.
Yung mga post, ganun, chika-chika.
Chika-chika.
Opo. Sige po.
Annelyn.
Senior.
Sorry. Hello.
Aha.
Di ba may open forum pa after ng panel discussion?
Ay, oo nga. Open.
Yung lahat silang 6 or 7 naka-open cam.
Ay,
unmute.
Bago mag-summary.
Oo nga.
Gumag-summary at mag-scan.
Yes. Mahaba-bawan din yun. Sige. Nabura ko siya. Open
Tapos,
cam.
ayan, open cam, 6.
Ano na yung pangalan? Saan na ba si Bonfa? Ayun.
Nandito siya kasama kay Doc, instead ng Dr. Navarra katabi ni Dr. Collante, yan, nandun siya, doon siya kasama. Nandiyan, spotlight din siya.
Dito? Pati si Bonfa dito?
Ang toxic ng pangalan niya, no, may ganun pa sa A.
Oo nga.
Kailangan i-copy-paste mo.
Yeah.
Oo. Siguro kuya, tanungin ko kaya si Kite kung nakapag-try na siyang mag-broadcast sa YouTube. Kasi nakapag-broadcast na dati yung para siya na lang kaya ang mag-broadcast sa YouTube. Oh, nag-iniisip ko pa na trabahuin niya. Wala akong siguro yun na lang kuya para siya na yung mag-login ng Ruma Center na pero magla-login ka rin ba sa Ruma Center, kuya? Oo. Oo. So okay lang kuya na dalawa kayong naka-sign in sa Ruma Center na Zoom. Oo. Kaya nga okay lang. Hindi. So ganito na lang pala kuya ang gawin natin. Okay lang kahit co-host siya. Ganito na lang pala. Naku, kaso baka mamaya i-try natin. Pwede tanong natin kung kailan tayo pwede mag-practice para matry niya kung makakapag-broadcast siya. Parang, hindi. Yung Gmail account ng Ruma Center. Oo. Hindi siya papasok kuya sa input eh. Papasok ba siya sa input? O paano ma-feed yung paano ma-feed yung questions? Kasi ang mangyayari kasi kuya, kaya ako yung YouTube. Pag may question nasa YouTube, ka-copy paste ko papunta ng input para mabasa nila Doktora Navarra para sagutin nila. Oo nga kuya, ang kaso isa lang ang laptop ko. Hindi ako po pwedeng parehong mag-sign in sa laptop ng input at saka output, 'di ba? Oo, ngayon paano ko mabo-broadcast using Ruma Center kung hindi ako magsa-sign in ng Ruma Center? Oo. So ikaw na munang mag-broadcast. Yun lang kailangan ko kuya kasi yun lang naman ang kailangan ko, yung code lang eh. Yung link lang. Kasi ipopost ko din yung link ng YouTube eh. Oo. Phone lang, phone. Oo. So siya ang maghahawak siya ang um ha- haharap hindi siya ang haharap sa laptop ng Ruma Center. So siya so siya na. Oo, alam niya kung paano i-maneuver yung para makapag-broadcast sa YouTube. Hindi ko rin kasi alam kung paano ko siya i-instruct eh. Oo nga kuya. Mm. Sa kanya lang ako magme-message. Sige, magme-message na lang ako sa kanya sa Messenger. Ang ano ko lang kuya is, tawag dito, siya ba ang ang haharap dun sa laptop na pinag-openan mo ng Ruma Center? Hindi, edi kung gamit mo yung laptop, di ba, yung ginagamit mo ngayon na pang broadcast, di ba kuya? Tawag dito, yan din ba ang gagamitin mo sa Sabado? O yun pala mismo, di nandyan na siya. Hindi pwedeng galawin. So hindi po pwedeng galawin. Paano siya magbo-broadcast kung hindi niya pwedeng galawin? O sige. So siya na lang ang tagapaalala. So sasabihin ko na lang sa kanya, sabihin ko na lang kay magme-message mag-chat ako kay Ate Heidi sa Messenger. Ate Heids, ano na tawag dito, broadcast sabihin kong in 2 minutes. Broadcast to YouTube in 2 minutes, parang ganon. Okay ba 'yon? Oo. Hindi, ngayon kuya, hindi rin ako makakapag-record sa output kasi ano ko doon, ikaw din 'yun. So yun din sasabihin ko sa kanya. Sila na lang kailangan i-co-host. Mag-co-host na lang sila, oo. So lahat ng panelist co-host na lang. Doon na sa output. Okay. Kasi ang pwede lang akong makapag-record or anything, makapag-start record dito sa input kasi itong naka-laptop ko. Okay, okay. Bigyan ako isa pang laptop. Oh. Oh. Hindi kuya kasi ganito yon. Baka mamaya yung headset nila, gagamitin nila dito sa input kasi magsasalita sila, di ba? So hindi naman sila yung yung gagamitin lang nila yung um, mic yung built-in mic ng laptop. Minsan hindi maganda yung quality nun eh. Kaya sila nag-headset. So assume mo na yung isa lang yung headset nila at gagamitin nila sa input. Ayun, kuya, sorry. Ano ba to? Sino ba to? Nandyan pa sila. Nandyan pa yung mga fellow. RA, patient partner.
Ma'am Robel, alis na po ako. Mag-emergency consult daw po kami ni Doc Navarra.
Okay, sige, Doc.
Okay po.
Naka-on yung alin? Hindi, kaya nga, kuya, dapat isama natin dun sa instructions kung kasama, 30 magla-login na sila 1 hour before 8 o'clock. So 7 o'clock nandyan na sila lahat. Maliban lang sa foreign speakers, baka 7:30 daw siya mag-login. So yun ang so tao dito parang na lang na lahat ng na lahat ng tao na dapat nasa input 1 hour before naka-login na. O tapos kuya, pa pala? Wait lang. Tawag dito, tsaka kuya, ikaw din pala ang sa start webinar, 'di ba? Sa output. Oo. O ka, 'di ba parati tayong naka-practice session muna sa webinar, hindi na tayo. So hindi na tayo magpa-practice session. Diretso na tayong open. Ay, na-receive mo ba kuya yung pinadala ko kanina? Walang audio yun kasi sabi kong ganun, di ba ka naman, mag-background music ka. Kaya tinanggal ko na lahat ng audio. Oh, walang audio. Kasi ginawa ko, kinat-cut ko na lang eh. Ito, papakita ko sa'yo. Ay, hindi pala ako pwede ako mag-screen share. Wait lang. Dali, hanapin ko muna. Lupus Roadshow.
Ma'am Robel,
Yes.
anong sasabihin ko? Sino yung mag-i-inform pala kina Doc, Doc LQ? Kami na lang. Doc Lisa, Doc
Siguro
Sheila.
Doc, sabihin nyo na agad at least today kay Dr. JLY para tapos saka mo siya tanongin, Doc, kung sino ang magsasabi, kung ikaw ba o siya na ang magsasabi dun sa mga boss.
Okay, sige.
Na yeah.
Para na
tawag dito, sila yung sila ang mag-a-answer sa questions in chat and Q&A.
Okay. Sige.
Thank you, Doc.
Okay. Ma'am Robel, pwede na bang mag-out dito?
Sige, Doc. Sige.
Okay, thank you. Message
Kami naman ni Kuya
ni
Marlon. Basta pag Doc, pag may naisip pa kaming mga sasabihin na lang namin, Doc, sa inyo.
Okay po. Thank you.
Thank you, Doc. Sige lang po. Sige po.
Thank you po.
Hello kuya, andyan ka na? Ayan kuya. Oh, so ganito na lang kuya ang ano natin, ang division ng labor natin. Ikaw, direct overall ka sa tech, 'di ba? Tapos ang support RA siya. Tawag dito, si Ate Heidi, support staff mo dyan. So lahat ng instructions na gusto naming sabihin, papadaan namin sa kanya para ano tawag dito, mabawas na din yung paggamit ng chat papunta sa'yo. Oo. Kasi pag nag-chat, lumalabas dito sa pag hindi mo napansin, di ba? Oo. Tapos, next, siguro si Kitty na lang, siya na lang ang support staff sa output. Tama ba? Oo. So, bali, magiging panelist na lang din siya sa output. So, magiging ilan na ba? 1, 2, 3, 4, 5, 6, 7 na tao na yung panelist natin sa output. Doktora Navarra, yung 4 na magtatanong, na mag-a-answer ng tanong, si Dr. Vincent, tsaka si Kite. Okay ba yun? Okay na yun. O, tapos ako, YouTube at saka support staff outside dito sa input. Tama? So, oo. Tsaka kung kunwari, kasi ang gagawin ko, nakatutok din ako sa output. Pag meron akong mga gustong, parang kunwari may mga instructions ako na, o kuya, pan mo dito, ipan mo sa ganitong, sa gitna, i-zoom out mo, o kaya ipan mo dito sa kanan na yun ang gagawin ko. Okay yon? Oo, lahat through Ate Heidi. Ano ba yung ballpen ko? Para siya ang tagapukpok sa'yo. Oo. Baka hindi mo na mapapansin eh. Binigay na daw sa'yo. Si Bonfa tsaka si Sir Vera, di ba yung flash mo? Si Bonfa na lang yung hindi mo pa na-flash. Tapos, kailangan pukpukin mo si Dr. Ivan. Kailangan pukpukin si Dr. Ivan kung kailan niya mabibigay yung recording niya. May support. Para iayos mo pa, oo. Support. Ate Heights. Input, output, YouTube. Ano kuya? Well, output. Oo, sila. Pero kuya, total alam naman na nila yung instructions kanina. Pero tuloy pa rin yung practice natin bukas. Oo, sige. Oo. Nag-meeting daw. Hindi ko alam. Hindi naman ako kasali. Hindi ko nga alam na meron nito. Nagulat lang ako. Oo. Ano kaya? Kuya, pwedeng pa-try. Tawag dito, ito malano na to. Alam mo kuya, yung kaninang ginagamit mo na pula, na border sa baba. Maganda yon pag naka-panel discussion, yung puro videos lang, yung 4, yung 6 sila, o kaya basta yung puro nagdi-discuss lang sila. Maganda yon. Kasi para siyang, yun yung style lang parang kunwari nasa CNN, ganyan. Yan. Oo. Kung ilagay mo ongoing, Lupus Roadshow. Yan. Oo. Medyo liitan mo lang siguro medyo ibaba mo ng konti yung red. Yan. Kasi kapag naka ano naman siya kuya, tawag dito, yung videos, yung mga box ng mga nagbi-video, meron naman siyang border pa yan eh. Maganda yan. Oo. Dun sa slides kuya, pwede mong gamitin yung kanina yung nilagay mo. Yan ganyan, yan. Pwede ba kuya? Kasi ang iniisip ko, ilalagay, yan yung nakalagay habang di ba instead na kung sino yung speaker, ayoko, ate. Oo. Ano ka, ate? Ikaw ang dakilang support staff ni Kuya Marlon. Hindi pa ba kayo bate? Lahat ng instructions namin sa kanya, tayo namin ipapadaan. So, i-chat ka namin sa messenger. Alay ko. Lahat kami. Mga fellow, saka ako. Kasi kunwari sasabihin ko na, ate, pasabi kay Kuya Marlon, broadcast to YouTube in 2 minutes, parang ganon. O kaya, Kuya, tawag dito, o kaya sabi ko, ate, pasabi kay Kuya Marlon, start webinar na, parang ganyan. Turn time. Meron, magpa-practice tayo, te. Wala naman tayong pasyente bukas, di ba, te? O sige. Natin. Sige, pag namin kung anong 20. Ang alin? Hindi, 20 lang kuya. Kuya, pwede bang masyado na kasing malaki yung border na blue? Pwede bang isang linya na lang yung Lupus Roadshow tsaka yung November 20? Oo, parang hindi, isang linya na lang siya kuya. Magkakasabay na sila. Parang masyado ng parang hindi ba pwedeng madikit doon sa Lupus Roadshow yung date? Para hindi masyadong, kasi kung na yan kuya, yung sa video, yung sa mga recording, baka mamaya masyadong kinakain na yung space. Liliit yung mo kuya, yung part mo nung slides, 'di ba? O yun yung pinaka-importante ate kasi tawag dito, baka mamaya pag para yung lahat ng instructions namin kay Kuya Marlon, makaka-relay sa kanya kasi baka hindi na niya mapapansin kung magchat-chat kami, mga ganyan. Sa messenger, te. Tapos, ano daw, ikaw daw ang ipapaharap niya doon sa computer. Kung ano ang computer yung ipapaharap niya sa'yo. Ayun. Basta kung ano lang, kung ano yung mga kailangan niyang tulong dyan. Oo. Okay, thank you ate. Yan lang. Oo. Kuya, i-try mo yung patry nga yung video recording kung maganda, kung gaano kalaki lalabas. Para makita natin kung may natatakpan ba siya or something, mga ganyan. Ah. Kuya, hindi kita kinakaya. Hindi kita kinakaya. Ayan. Pwede bang Ayan, sige, baba pa. Hindi, kuya, pwede pang patry na yung recording yung ipapakita natin kasi mas malapad yun eh. Oo, pwede bang pa-share screen nun?
Thank you very much for your kind invitation to participate at this Lupus Academy meeting, and especially for the possibility to talk on this complicated hypercoagulability conundrum that is the combination of COVID-19, thrombosis, and the antiphospholipid antibodies. These are my disclosures. And these are the learning objectives of this talk. I would like that you manage to recognize the clinical and subclinical thrombosis as important challenges in the management of patients with severe COVID-19. Also, to describe the options for the prophylaxis and treatment of thrombosis in patients with this condition, and to discuss the new trends in research on the pathophysiology of thrombosis in severe COVID-19, including the potential role of the antiphospholipid antibodies. Well, at this stage of the pandemic, everybody already knows that COVID-19, in addition to the initial viral response phase, in many cases presents also an autoimmune response, a host inflammatory response phase. And in some patients, this is accompanied by a terrible cytokine storm or a systemic inflammatory response syndrome, a syndrome that we, with Professor Schoenfield, coined the term, the very expressive term that this is a hyperferritinemic syndrome. But it was really a surprise, but we realized very soon that in addition to this systemic inflammatory response, there were many thromboses, arterial, venous, and also thrombosis in the microcirculation, complicating these patients. So it was very soon put in the list of clinical manifestations of the critical severe COVID-19 infections, in addition to the respiratory failure, to the septic shock, the multiple organ thrombosis that appear in some patients. And also that was accompanied by the classic laboratory features of this condition, high levels of ferritin, high levels of the D-dimer, LDH, troponins, and so on. And a lot of literature appear linking this COVID-19 with microangiopathy, hemostatic abnormalities, also complement activation. Actually, this means that we are entering in a very complicated issue, which is hemostasis. And if we put together this complicated issue of hemostasis plus COVID-19, we are certainly in a hypercoagulability conundrum. And in just a few months, many studies have appeared, many publications have appeared, and it's really a very complicated issue. It's full of literature, articles trying to disclose some information, some clear information among this terrible conundrum. Starting by pathophysiology, many mechanisms of action, of production of these thrombosis have been implicated, starting by endotheliopathy and vasculopathy, through platelet activation, complement activation, till also the antiphospholipid antibodies. For instance, the group of George Goshua stressed the importance of this endotheliopathy in COVID-19 patients. Also, hypercoagulability and fibrin potential role of the antiphospholipid antibodies in the thrombosis associated to COVID-19. And we performed this very nice study that we have just published, and that I will just summarize in the next few slides. We, at the beginning of this pandemic, we managed to collect 474 COVID-19 hospitalized patients, and to collect the data and the serum from these patients, and to also we collected a control group of 131 patients. And we analyzed the levels of antiphospholipid antibodies in these patients. And while for the classic antiphospholipid antibodies, that's lupus anticoagulant, anticardiolipin antibodies, and then the IgG and IgM, anti-beta-2 glycoprotein 1 antibodies, the prevalence of these antibodies was similar both in patients with COVID-19 and in the control group. It was around 4 to 5%. And the same for antiphosphatidylprothrombin prothrombin antibodies. However, the presence of, or the prevalence of IgA, anti-beta-2 glycoprotein 1, was clearly higher in patients with COVID-19. It was 15% as compared to 6.9% in the control group. However, we analyzed if these antibodies were associated with thrombosis in these patients with COVID-19, and certainly no association at all between these antiphospholipid antibodies and the thrombosis that presented some of these COVID-19 patients. And there was no association with thrombosis, and also there was no association with the prognosis of the patient, with the survival of the hospital discharge. So we can say that COVID-19 thrombosis mimics in some way the antiphospholipid syndrome, even the catastrophic antiphospholipid syndrome, but it is not clearly an antiphospholipid syndrome. However, very interestingly, what we did in addition in this study was to compare the levels of the beta-2 glycoprotein 1. You know, the beta-2 glycoprotein 1 is the cofactor of the antiphospholipid antibodies. Well, we compared the levels of this cofactor among the three groups, among the COVID-19 patients, also the control group, and also blood donors from our blood bank. And very interesting, as you can see in this slide, much lower levels of beta-2 glycoprotein 1 levels were detected in COVID-19 patients as compared with the blood donors or with the control group that we analyzed in this study. So, probably what happens is in these patients with COVID-19 is something that already Pierluigi Meroni, Angela Tincani, Laura Andreoli already hypothesized a few years ago, is that increased apoptosis leads to the consumption of beta-2 glycoprotein 1. And this consumption of beta-2 glycoprotein 1, these decreased levels of beta-2 glycoprotein 1 also leads to thrombosis. So this journey, this pathway
Siguro kuya, ganun ano. Pagpasok ng, hello kuya. Sige, go lang. Sige. Hindi, sige, kain ka na muna kuya. Oh, tita pa. Sabi nga niya, sabi ganun, gusto kong makita si Heidi, hindi ako mag-o-off. Hanggat hindi ko siya nakikita, sabi ni Doktora Navarra. Oo. Tapos sabi niya, Kuya Harmar doon, ay Doktora, naliligo po siya. Oo. Kaya, bali kuya, pagpasok, yan muna. May background music ka. Pwede mo pa bang maiurong? Hindi na. Para hindi makita yung nasa right. Kasi nakikita yung nandito sa gilid sa right eh. Yung ano, yung mga non-copyrighted. Yung mga word niya, no? Oo. Ayan, kuya. So, pag nag-start, dyan muna. Pwede kaya? Pwede naman, di ba? Oo. Tapos, kasi yung ginawa ko, kuya, siguro mga less than 7 minutes yun. 7. Less than 7 minutes. So, parang mga 7 minutes before the time, tawag dito, 7 minutes before 8 o'clock, pwede mo na siyang i-play. So, ililipat mo yung Zoom mo doon sa screen sa right. Tama? Doon mo siya i-play, di ba? O parang ang gagawin mo, kuya, yung ginagawa natin, zoom out muna lahat. Ayan, yung ganyan, yung para stage, tapos dilipat mo doon sa kanan. Yung parating blanco. Yan mo siya i-play. Di ba sabi mo, dyan mo siya i-play? Ayan, ganyan. Oo. Oo. So, 7 minutes yon. Actually, siguro mga 6 minutes, 30 seconds, ganyan. So, para 30 seconds, magsa-start na 8 o'clock, mag-instruct ka na ngayon sa lahat na nandito sa input na we will start in 30 seconds. Diba? O para quiet na sila. Para prepare na sila. Oo. Tapos ngayon, pwede bang zoom out muna yung buong stage. Yan, stage. Tapos, saka mo siya i-zoom in dun sa gitna para sa start na ng prayer, lupang hinirang. Para ma-highlight natin na, ang ganda ng stage natin. Ang ganda ng studio natin. Ayan. Ayan. So, gaganyan mo na ngayon. So, start na ngayon ng prayer, lupang hinirang. Tapos, yung lahat na ng videos, dire-diretso na. Oo, kuya. Diyan na lahat. Para hindi ka na maglilipat-lipat. Oo, hindi mapapakinggan din na hindi ba nila hindi na nila mapapakinggan dito. Mapapakinggan din nila dito, di ba? Okay. So bahala na silang makinig sa bahala na sila doon. Hindi, wala na kasi lahat ng intro, dire-diretso na 'yan, kuya. Lahat na 'yon ipi-play mo 'yan dire-diretso. So, yan? So, prayer, lupang hinirang, yung intro ni Doktora Yu, tapos kay Doc Ivan, kay Cervera, kay Bonfa. Ano na, kuya, kailangan naka-sequence na sa'yo. Oo, oo. So, kailangan mabigay nila Doktora Dani yung kaninang ginagawa niya. Oo. Oo. So, pagkatapos ni Bonfa, um, Zoom, tawag dito, parang i-zoom out mo muna para yung buong screen. Tapos si Doktora Navarra. Hmm. Siguro bigyan din kita kuya ng ganun. Wait lang ha. Yung kung ano muna kung left, right, middle na screen ang ipapan mo, no? Hmm. Oo, oo. Oo. Webinar o dito sa input. Naka-phone lang ako eh. Sige. Oh, sige, diyan na lang ako magchat-chat. Oo. O kaya pag hindi, sasabihin ko kay Ate Heidi. Hindi Mm. Oo. 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 Yung practice mo. Sige, sige. Sige. Oo. Hindi actually yun ko yung ine-expect ko. Ipi-play mo isa-isa. Oo. Kasi feeling ko lalabo siya kung i-record mo. Delete na naman siya. Try mo muna kuya, medyo diskumpiyado ko eh. Hindi kuya, ganito kuya ang sinasabi ko Um, pag ni-record mo dito sa output, liliit pa siya kasi maliit na yung screen. May mga ka pa, tawag dito, meron ka pang itong mga nandito sa mga paligid, di ba? Oo. Mm. Hindi, kung naka-sequence naman siya sa folder mo kuya, hindi ka naman mangangarag kung nasa isang folder lang siya. Oo. Hindi, ang sinasabi mo ba kuya, pagtatagpi-tagpiin mo na lahat ng video? Oo. O sige, tignan lang muna natin kuya, wag mo munang masyadong yun kasi medyo feeling ko hindi maganda yung quality eh. Kapag yun ang ipapadala natin, yun ang papakita mo. Ewan kung mm. Hindi, depende kasi yun kuya. Depende kasi. Kung kunwari talagang marami siyang information na kailangan ilagay o kaya kunwari yung mga graph na ano talaga yung kinapi-paste nila from journal or whatever, wala silang magagawa doon. Maliit talaga lalabas yun. Sino? Ay, may message ko na lang siya. Sige. Message ko siya dito. Syempre, pwede lang tayo mag-suggest, pero syempre sa kanila naman din yung final kung paano nila gusto. Hindi, yun nga kuya yung ano ko, tawag dito kasi may time ka na nagzo-zoom in ka. 'Di ba yung may part na tinanggal mo na yung video ni Sir Vera, ang pinakita mo na lang yung slides. Yun, parang yun discretion mo kuya lalo na kung maliliit yung sulat. Parang i-zoom in, zoom out mo yung parang style ano talaga, production, TV production talaga. O yun, ganun. So ikaw na lang kuya mag-ano nun, mag ano nun, o kaya pag nakita ko, sabihan kita, kuya, zoom in mo dun sa slides, parang ganun. Kasi hindi masyadong mabasa, parang ganyan. Mm. Mm. Oo, oo. Oo. So yun, so kuya yun, yung sinow mo, yung plinay mo, ano na yun, naka-record na yun as is na ganun. So ikaw ang nagko-control o ikaw ang nagko-control pa? Kinokontrol mo pa? Tignan natin yung quality. Pero ano mo muna kuya, medyo hesitant ako, sorry kuya, pero medyo hesitant kasi ako eh. Pero wag mo munang masyadong ano, tingnan muna natin kung anong kalabasan. Kasi recorded video na kuya. So syempre, hindi mo na masyadong ano yung quality. Tapos i-record mo na naman siya ulit, edi mas lalong bababa yung quality niya. Hindi ba ganoon? Nagsend na daw si Doktora yung sa'yo ng recording niya. O yung intro. Intro lang naman yung recording niya eh. Live na yon, live na. Hindi, yung sa group chat natin. Hindi, may kasunod na, wala ka pang na-receive. Sabihin mo, ikaw na lang ang magbibigay ng link. Hindi, kaya nga, sagutin mo siya, si Doktora yun, na ikaw na lang ang magbibigay ng link for input and output ngayon. Oo. I-email, sabi mo i-email, oo. I-email mo na lang kamo. Monitors in this chat group. Oh. Hindi, kaya nga, pwede mo naman siya, no? Doktor, ano kasi, tawag dito for, pwede po bang ito na lang, kasi sabihin mong ganun, para lahat ng control nasa iyo. Sabihin mong ganun na lang sa kanya. Sabi mo, Doktor, okay lang po ba ako na lang po magbibigay nung Zoom link for the practice tomorrow? Sabi mong ganun, para po ako na yung, parang ikaw na yung may full control, para hindi ko na maghihingi hihingi mo pa siya ng host, sa chuchuchu ever. Ikaw, nasaan ka na? Hindi, sabi mo gano'n, o sige, sabi mo pero sabi mo, this is for input, Zoom. Sabi mo gano'n, link is for input, Zoom. Tapos, bigay ka ng link for the output, Zoom. Yung webinar natin. Ayan, silawan ko lang sila, Doktora Sora. Sa email. Walang sound yan. Kasi 'di ba sabi mo, yung background music na lang yung natin, ang niyan. Kaya tinanggal ko na lahat ng audio niyan. Tsaka cut kasi yan, kaya kaya walang matinong usap diyan. Oo. Oo. Para ikaw na lang din mag-record. Pwede daw siya ba siya mag-record? O ngayon sabi mo, pa-record mo na siya ngayon? Para diretso na lang sa'yo, kuya, yung lahat ng recording, hindi na niya si-send. Oo. Sa input. Bukas pa din. Bukas pa din. Sige. Hello, kuya.
Hello, Kuya Marlon. Can you hear me? Robel?
Hello, good evening po. Sorry, nakamute pala ako.
Okay. So, dito na ako mag-recording para pati yung ikaw na bahala mag-ayos pati video kasi kung ako lang baka mali-mali tingin ko eh.
Sige po, Doc. Pwede po.
Mabilis lang naman to. Pa
Okay
mga 20 minutes. I-share screen ako.
Okay po, Doc.
Okay.
Si Dr. Yu nasa Messenger. Sabihin niyo lang po, Doc, pag ready na.
Okay, okay. Andiyan si Robel. Hello, Robel.
Nakamute po siya, Doc. Baka kumakain
Okay.
po.
Anong oras na tapos meeting nyo ni Mama? Ngayon lang?
Kanina pa po, Doc. Kami lang ni Robel nag-uusap po dito sa technical side.
Mag-share screen na ako ah.
Okay po, Doc.
Okay. Can you see my slide?
Apo, Doc. Malinaw po.
Okay. Saan na ba ako yung camera ko? Ayos naman yung buhok ko. Kay Marlon.
Apo, Doc. Apo, Doc. Gwapo, Doc.
Oo, sige. Okay. Mag-start na ba ako? Ano ba? Paano ba?
Sige. Teka lang po, Doc. I-testing ko lang po record muna ako kung maganda yung quality. Testing ko lang kung okay yung